Now, there was a very good article by a man called Michael Robbins, and that's one of the articles that's up here, which you can take away with you at the end if you would like to. He talks about his treatment of a schizophrenic patient called Caroline, and this is what he says. Caroline used to speak in this schizophrenies type of language, and Michael Robbins says this: "One day, in a poorly concealed moment of exasperation and without much thought, I remarked that she was speaking schizophrenies, a language I did not comprehend. She was taken aback and informed me that I was the therapist and she was the schizophrenic, and it was my job to understand her. After unproductive discussions that spanned several sessions, I suddenly had the liberating thought that whether or not she chose to learn from me, I was not trapped in a hopeless situation. I could terminate with her or learn from her, and I told her that I would choose the latter course, and she would henceforth educate me about schizophrenies. In situations where hitherto I would have felt hopeless, angry, and bored, I pulled out pad and pen and took the verbatim notes that years later she gave her permission for me to use as data for this paper. I questioned her in detail, as though I were a student asking the professor to explain the lecture. To my surprise, my self-serving action finally got Caroline's attention when what I had thought had been my effort to care about her had not." Now, Michael's patient Caroline responded to him when he declared openly his ignorance. What Caroline then met was Michael's truth, his real emotional state, and this penetrated through to Caroline. And I think when that sort of thing happens, initially the patient is always angry, and they do say exactly what Caroline said to him: "You should know, you're the therapist, you should know." A core belief in the psychotic part of the personality is that there is a divine being who knows and who can heal. When I was treating that psychotic patient that I mentioned that was so formative for me, I went a couple of times for supervision with Bion, and when I just started, he said to me, "And she had the idea that you would be able to help her, did she?" And he didn't say anything more, but I understood what he meant, that the mere fact that I was sort of posing in the position that I was going to be able to help her already colluded with the idea that here was a God that would be able to cure her. And it is a core belief in the psychotic part of the personality that there is a divine being who knows and who can heal. And of course, it's slightly added to. People do a long training in psychoanalysis or and they begin to think they should know, and that's a great mistake. So then dishing out interpretations or medication is seen to come from this sort of divine being. But the problem is, when the patient has that sort of relation, their inner state is passive. So by pretending to understand, the therapist is saying to the patient, "Yes, your belief that I am God is correct." And the false belief remains in place. Also, it is only when someone begins to be physically active, psychically active, emotionally active, that they come into contact with themselves as they are. You never really come to a sort of a picture, an understanding of yourself, unless there's an emotionally active sort of activity going out of you. This schizophrenic patient's true self was masked by an omnipotence until Dr. Robbins revealed that he was not God but an ignorant human being. With this false belief dissolved, the patient now had to turn to bring her true self into action. And this brings her into a connection with herself and some sort of then awareness of herself. There's a French philosopher called Maurice Blondel, who said, "We are unaware of our face as long as a mirror does not reveal it to us. Action and I would put in here, emotional action is the mirror that offers us a visible image of our character. It's very important, therefore, when listening, not only to a patient, but to anyone, whether the words spoken represent passive ingestion or active engagement. And it's very important, I think, in terms of treating patients of this sort, that we need to sort of try and develop an instrument inside of ourselves that differentiates ingestion from personal discovery. And I don't know if you know what I mean, that if you hear someone and you sense that it's just being said because it's ingested, and as opposed to something that's really been inwardly created and understood. And that differentiation is essential. And patients who are very disturbed, paradoxically, they know the difference between those two. And an example I've given once or twice, but I'll just give it again. This same patient I've referred to, when I was treating her in the sort of second phase of her analysis at the Tavistock, at the end of one session she refused to leave, and I got a bit hot under the collar for a moment. Then I thought, well, actually I don't need the room for the next half hour, so I sort of left her and went out. And I realized that she sort of needed a bit of time to get herself together. I was seeing her 4 times a week, and that's what happened then. I used to leave the room and she'd leave sort of a few minutes later. But one day, I think it was a Tuesday, I needed the room straight away for a seminar or something straight after the session. So I asked her if on Tuesdays she would mind leaving, and she didn't demur for a moment. The reason she didn't demur was she knew there was a real reason, whereas the other was, thou shalt leave at the end of a session, and she wasn't going to do that. She could tell the difference between those two. When I was writing this, I wrote to Michael Robbins and I sent him what I've said above, and he sent me a very long reply. But in it he said, with all my patients, I often tell them I don't understand and make them explain. It isn't a therapeutic ploy, for I truly don't, and admitting my ignorance, as you suggest, punctures a balloon of grandiose collusion and also relieves me from the one-sided task of trying to do all the work myself. But with striking frequency, it leads to a realization on their part that they didn't understand either. And you see, I think that, to my mind, connects with what I said about what Maurice Blondel says. It's only when they become active and have to make that type of communication do they then realize that they don't understand. The other thing I think that's quite important is to realize that it sounds a bit odd to say this, that the psychotic area isn't located anywhere, and this is a source of inner terror. If you imagine, for instance, just waking up suddenly and you find you're in some spacecraft miles away from planet Earth, and you're nowhere near any other planet, and you don't know where the spacecraft is going, it's just sort of going out into outer space. It's a terrifying state. All the thing that we talk about and that is in the psychiatric textbooks about the concrete is an attempt to hold on to something solid out of fear of this empty nowhere. And it's this sense of that's the only way I can put it, really, but I think that's a very fundamental type of terror that is in these patients. One can think about how it is that that's come about and what has happened between mother and infant for that to occur.